All right, so here we are. Let me just figure all this out. All right, welcome to this webinar. We're just going to get started in a minute or two. Just let people figure out their Zooms and everything. And then we'll kick this off. If you are already here, for you who are here, you can ask questions throughout this event. So first of all, welcome to this session. We're going to talk about the integrated journey, which is a very unique model of pursuing surrogacy and IVF and egg donation, if that's what you are in need of. So we're going to be discussing that today. We are going to have a Q&A at the end, but please feel free to shoot in your questions if you do have any during the presentation, which is totally fine. And let's just give people another minute or two. We're going to end on time here in about 30 minutes, making sure that everybody can continue on their day with whatever they have going on. Depending on where you are today, it might be day or evening, but I hope you're all doing well. So we're just going to give it another minute. If you do want to ask any questions throughout this webinar, you can actually use a Q&A button somewhere on your screen, depending on if you're on iPad or whatever, or a smartphone. So please feel free to use that. Put in your questions and we'll get to them at the end of this webinar. It's anonymous to ask questions. Only I can see them on our side with the team. So please feel free to do so. And yeah, any question is welcome. It's all about learning more here. I'm sure we are all in different stages of our research. Hopefully somebody can learn, a little bit of something from this presentation here. But yeah, feel free to just shoot ahead with your questions. All right. Sorry, I have a little bit of a weird voice today. Something coming on. Hopefully nothing serious. All right. Well, let's go ahead and jump into this little presentation here. Just give me 1 second to figure this out. All right, let's get started. Just some of our lovely IPs and surrogates here on this first slide. Love these pictures and journeys, of course. One of the best things having baby photos, of course, of those journeys, but these are lovely as well. So let's look at today's schedule here. We're going to have a little bit short introduction, and then we're going to talk about Hatch and PFCLA, just very briefly for you who are not as familiar with Hatch and PFCLA. I know there are a couple of you that are here, but if not, we're just going to a little bit short about Hatch and who we are, and PFCLA, our in-house clinic. And then we're going to move on to talk about the integrated journey, what that means in terms of, we're going to look at a timeline of how that works kind of time-wise and how we move simultaneously through some of these steps in the integrated journey. We're going to talk about roles and responsibilities. As you can imagine, there are quite a few roles and quite a few responsibilities as well in the journeys. We're going to talk about what roles are there, what are their responsibilities, and then we're going to talk about the integrated journey, basically like doing a vertical journey and what those benefits could be for you. And we're going to discuss further our Peace of Mind program, which is kind of the basics of the integrated journey, right? That's our program for that all-inclusive journey. Discuss what that means and what that is. And then we're going to talk briefly about customizing your own journey to parenthood, because as we often say, no journey is, the same. Everybody has their own, ideal journey or ideal choice of a journey. There's no right or wrong journey. It's all about choosing what's best for you, depending on where you are at and what you need and where you want to get in the end. And then we're going to do a short Q&A as mentioned. But like I said, feel free to get the questions going if you want to, and we'll catch them at the end. All right, I'm your host today. So I am Edwin. I'm the international manager here at Hatch, our agency, and PFCLA, which is short for Pacific Fertility Center, Los Angeles, a long name. That's our in-house IVF clinic. And I'm also a two-time father through surrogacy and egg donation, international in my case. And we have a great, lovely team of both international and domestic intended parents with experience and a bunch of great, amazing previous surrogates, many of them with Hatch, who also are a part of our staff here. So we all have that personal experience, which kind of is great to bridge that gap between, professionalism, structure, coordination, but also that humanitarian approach, really understanding how it is to go through the good times, the rough times, anything in between, and do that with, sympathy and with the human touch. This is a little bit about our agency. So just give you a little bit brief background on Hatch. Hatch has been around for a very long time, running up towards its 34th year as an egg donation agency, actually the first egg donation agency, and the surrogacy agency. We have over 3,300 birds since the start, which is an amazing amount of babies through the program. Very proud of that. And as I said in the beginning, one of the best moments of, I think, any of our job is to see that lovely baby picture when there's been a delivery, and knowing that everybody is doing great and well, and hopefully seeing a little cute little face as well. That's an amazing, thing from start of your first conversation with somebody until they have their child. That's an amazing thing. We work with clients from all over the world on the agency side, US obviously, and a lot of other countries around the world, in over 55 of them so far, which is an amazing thing as well, to be able to, help people build families all around the world. Success rates do look heavily at, did you have a child or not through our program? In our donor programs, the surrogacy programs, we're looking at a roughly 99.5% success rate, which is amazing to be able to control that process. And also with the integrated journey, we'll also discuss that, accountability and having our hands on the process, how that kind of helps with keeping that success rate high. We have great attorneys we work with. They are our partner attorneys. We work with some of the best in the business. We can refer them to clients that need that referral. And they're amazing at what they do, very knowledgeable, of course, and have done thousands of surrogacy journeys and agreements and processes. So they're an amazing resource for us to have. And then we have our own doctors in-house as well, which is something we'll discuss with the integrated journey, the benefits of actually having our own clinic and thus having amazing medical support and medical guidance in a journey that is heavily medical, right? While agencies usually don't have that medical expertise, this is a really great, amazing thing. And I'll show you a little bit of what we can do with that expertise in-house. And this is just a little bit about our clinic, Pacific Fertility Center, how many birds, surrogacy birds so far. I think we have over 13,000 birds in total, and 4,000 of those being surrogacy birds. A number of years of experience, running up towards 31 years. Our first transfer pregnancy rate, so creating an embryo from a donor egg, transferring that to a surrogate, what's the likelihood of a pregnancy? And just most of our business today being surrogacy, fertility actually connected to that in one way or the other. All right, so let's talk a little bit about the integrated journey then, and how all that works. So the integrated journey is something quite unique and very new that we were one of the first ones to create. So the integrated journey was really created from a couple of key aspects of, what people found was really rough in surrogacy, especially. One of those things has to do with coordination. The other thing has to do with finances. And the third thing has to do with medical expertise. And we'll look at all of those one by one when we go through the benefits of the integrated journey. But this is basically to give you just a little bit of introduction. So we looked at the agency, we looked at the clinic, right? These are usually very separated from each other. It's a very fragmented approach to this journey. So today we do offer an integrated journey and approach. We call that the Peace of Mind program, which we'll look at the end. So this is a kind of one-stop shop, if you will, all-inclusive place for everything fertility related. So anything from, egg donation and surrogacy to the IVF clinic, to, providing great legal services and referrals, through taking care of the insurance process and coordinate all of that with the IVF clinic and all these other third-party providers. That's the core of the integrated journey. And that's what we do here. So we have our hands on the process, beginning to end, as far as the agency goes and the clinic goes. So Hatch does everything non-medical, while Pacific Fertility Center focuses on everything that is medical. And we just do that journey with one team in one place, with a fixed fee structure and with medical expertise in-house. So we'll look at that a little bit closer, but that's a really different approach to how surrogacy has been done for a very long time. And something that we get excited about, and a lot of our intended parents obviously get excited about as well. So let's look at the timeline here a little bit. So the timeline of the surrogacy, egg donation, and IVF journey can look very different depending on loads of factors, everything from, matching times, but also to, matches falling through, or surrogate screenings falling through, rematches occurring, etc. So it's really important to try to focus the timeline not only on the time to match, which is usually the first focus for a new intended parent, but also the time from actual match to pregnancy. How does that journey look in terms of rematches, in terms of, failing the screenings, in terms of, you know, having a great relationship and coming to an agreement with your surrogate in terms of, you know, agreement, etc. So we won't walk you through all of this today, but the point with the integrated journey, as you look at this timeline, as it's evident, you know, a surrogacy journey is sometimes long, taxing, you know, it can be an amazing journey, you know, with few challenges, but there can also be quite a few pitfalls. So in our approach to kind of make sure that in the integrated journey, you kind of can pursue this as a whole at the same time. So if you look at the surrogacy process or the egg donation process, also the clinical process, we usually push those three forward at the same time. And sometimes you will get advice, especially from clinics, to kind of start the donor side first, wait with the surrogacy side. Actually, you can pursue those simultaneously. So you can actually save quite some time on your surrogacy match list, for example. Looking at matching times, you know, large established agencies can have matching times anywhere from 8 to 10, 12 to 15 months and upwards. So one way to make that more feasible is to get on the match list and create embryos at the same time. In the integrated journey with our Peace of Mind program, that's what our clients usually do, our intended parents and our patients. So that kind of pushes the focus on the egg donor side and making sure that you choose a great donor and you create an amazing amount of embryos and you have all that set up while your surrogacy matches is moving forward. So one of the first things that happens is that you sign up on the match list, you start your donor search, and you make sure that the male, if you're not using a sperm donor, etc., comes to the clinic for testing and screening and sperm deposits. So you're spending some time finding the right donor, which can take much longer than people sometimes think. They think, you know, they'll just do it quickly and briefly. They have the donor set up. There could be different reasons for having a donor setback or a rematch, etc. And sometimes you're just not finding what you're looking for from the beginning. So this can take quite some time, much longer than most people think. But when you do have a donor match, then you have a donor being screened. First pre-approved by your clinic, of course, and then screened. If everything looks great, then you move on to legal contracts and the donor will take some medications. You retrieve the eggs, of course, using that semen, if it's a sperm donor or from the actual intended parent, you create the embryos, right? You do genetic testing, PGTA testing. That's one of the things we require in our hatch programs. Not all programs do require that. You can also speak to your doctor about that part. And we do genetic testing and we freeze the embryos down. So for many of our intended parents in the Peace of Mind program with the kind of integrated journey, they moved forward throughout that process until they have embryos. They might have reached their match time. They might have gone above that, but usually there's a couple of months left and they would have their surrogate match. We do the matching. We do a surrogate medical screening, and we'll talk about the medical benefits of the integrated journey here. We do a legal contract, medications, and then the embryo transfer. Hopefully there's, you know, a pregnancy that occurs and confirms at the heartbeat at about week 6. And then we hope for an uncomplicated pregnancy and delivery. So this is to give you kind of a rough approach to like the timeline of the journey, and also how something that is integrated and more kind of all-inclusive can be a more timely approach to this, because you're not just waiting to create embryos first and then jumping on a match list. You can move that along at the same time. So I think that's just a nice overview for those of you who are a little bit more new to this journey to understand how that looks in theory. Let's talk about roles and responsibilities. So when you look at this journey, there are a lot of people involved, a lot of roles, a lot of companies, a lot of escrow, third party. There's a lot that goes into making this happen. And these are a couple of them. For example, legal teams to take care of all the legal work, birth certificates, agreements, etc. Clinic, of course, all the medical, egg donation, if you're looking for that's an important aspect. Insurance is very crucial for this journey's ease and stress, stress relief. Intended parents obviously are an integral part of this journey, as are surrogates, but also family and friends can be much more involved in the journey than you might believe. And it could actually be much more useful to give support throughout the journey. Agency obviously is very pivotal for the journey, but also other services, like I mentioned, escrow accounts, etc. And there might even be more if you're working with, concierge services or somebody to book your accommodation, etc. Like there's a plethora of different services out there for this journey. But this gives you kind of a sense that there are quite a few roles involved in this. And that's why we usually call this journey a village. So you will probably hear this more than once. It takes a village, it takes a village. So I thought it would be very seemingly fitting to introduce this as an actual village. So if we take these different roles and we put them out there in an actual village, you can see that there are quite a few people involved here in this approach of getting this done. From my own experience, there is a lot of people to communicate with. There's a lot of different roles to understand, and they're kind of how they fit into the whole process. So it is literally a village that's going to support you throughout this journey, something like this. So when we do have this as a village, that does give birth to a lot of different issues, right? So, for example, who is holding this all together? Like, who's really responsible of making sure that this is following through in a great way? Does everybody know what's going on? Is everybody on the same page as where are we in the process right now? What we are expected to do right now? Am I expected to, send something over to the clinic? Should I communicate with the agency? Like, there's a lot of that as well that's important. But also, not only if that communication exists, but also if that communication is efficient. There's definitely a lot to be said about efficiency in terms of how quick do we communicate, how clearly do we communicate, and how much do we know each other in this communication and work together for the benefit of intended parents. Also, when we have miscommunications, we're risking at prolonging journeys and different steps as we're missing things. So that's something that also can fall between the chairs. What do you need to take responsibility for as an intended parent yourself between all of these different roles and responsibilities? And kind of the last thing being, if everybody's just covering their own base, it's easy to lean back and say, we did what we needed to do, but it's also important to make sure that, you're communicating that with everybody else in this journey. So these are just a couple of different issues that could arise from that kind of village that it takes to go through this journey from start to finish. So if we go back to that village, then it creates these kind of discrepancies or like issues in communication, etc., between all of these different roles. So the integrated journey or our peace of mind program, the whole idea behind that is to, instead of have this potential miscommunication or fragmentation, etc., we just thought that we could bring that together into one cohesive program, one cohesive integrated journey, basically. So it doesn't have to say that everything is included in one place. So for example, we have great legal partners for the purpose of representing you independently as your legal representative. We feel that that's ethically, morally better done with an outside legal team rather than in-house. But the most important part is having a great legal team, actually. So it doesn't have to say that everything has to be that kind of integration, but there are two big integral parts that are important for that, and that is the agency and the clinic. The agency obviously being responsible for the surrogacy side, ideally the egg donation side, even though that can be more flexible if you choose a donor from another agency or not. But kind of building that together for more of like this kind of journey, an integrated journey where we build that all together into one place. And we did that with the agency and clinic together when we created this program. So let's talk about the benefits of that. So looking first at something that isn't all too exciting in a surrogacy or egg donation or IVF journey, but that is actually very, very pivotal for the success of the journey. And that is coordination and communication. So what we wanted to do is that we wanted to create a team that really works closely together to create that seamless experience from both agency and clinic. You still have two teams, right? You have, an agency team, you have a clinical team, but as far as them knowing each other, having that experience of working together, collaborating together every single day, that is very important. So not only for like communication to be very smooth, but also for it to be clear of what are our standards, what kind of protocols do we follow, what are our step-by-step processes to get to the end result. That creates this transparency and clarity between the agency and clinic, which really hopefully creates a smooth process where there's less miscommunication, less unknown factors, and just a better focus on getting this done and having a great experience during that time. So there's a lot to be said for that coordination. As an agency, we work with many other great clinics occasionally. As a clinic, we work with many other great agencies, if that's the choice of the intended parent or the patient. But this is kind of like a cohesive approach to try to make that more beneficial for coordination. If we look at the medical side of things, which is very interesting, and something that I think we sometimes underestimate, at least as intended parents in their first journey, just like I had my first journey, we tend to underestimate how heavily medical this journey really is. And when it comes to that, traditionally agencies have been kind of involved in that without having the medical expertise necessary. You still need an agency in that sense, but it's really important to have physician oversight. So when we do have this integrated approach and our Peace of Mind program, those kind of heavily regulated environments of the medical clinic, they spill over to the agency as well, because agencies aren't that heavily regulated in that sense. But IVF clinics are obviously very heavily regulated. So we like that kind of spillover effect. It creates something more, a higher standard for what a medical expertise is and how that's important in the journey itself. It also gives us opportunities to do some really amazing things. For example, all the donors and surrogates that we actually accept into our program, we have all the medical records be reviewed pre-match by our chief medical officer, who has actually 30 years of IVF, surrogacy, egg donation experience, rather than having the agency staff or the agency itself do that, which actually don't have that education or expertise. So it's kind of like, here we want the medical staff to make medical assessments, not the agency staff or the agency. They should stay out of that because we are not medical experts nor medical professionals. So the benefit of that is when you look at, for example, a surrogate match, you know that the candidate actually meets the medical criteria of your IVF clinic and doctor up to that point. There's still an in-clinic medical screening, of course, that's going to take place, but it's kind of comforting to know that the risk of having a rematch, for example, etc., is much less likely because of medical disqualification than the general average, which is quite high. We're talking about somewhere between 25 to 30% of the time, while we're looking at significant lower amounts here because we can do that earlier. And not only can we do that medical records review, we can also do a uterus lining assessment, which is very important and very useful. Even with other clinics we occasionally cooperate with, they love that part. That Hatch has done a medical records review with the doctor, but also uterus lining check, and we have those assessments and results ready. It's also kind of nice that your IVF doctor that kind of at the same clinic that your surrogate was cycled through has already approved those medical records, gives you more, the confidence of a smoother process. But it's also a timing issue or a timing factor that sometimes in some clinics and doctors will spend up to 6 to 8 weeks to review medical records of the surrogate, and that stalls the process. And a lot of intended parents get frustrated about that, which is a bit of a waste of time. It should be done very thoroughly, but if you can come and do that before and kind of prepare for that, then you could probably have a smoother process post-match as well. So there's a little bit of that medical benefit of having that journey all together and in that integrated process. If you look at finances and financials, there are also benefits of that. So in the integrated journey, in our Peace of Mind program, we offer that as a single fixed fee program. So you can go to our website, for example, and have a look at some of those plans. Not all of them are listed, but I think all of them are somewhere represented there. It also includes everything that you need, agency and clinic, because there are occasions when agencies would say, for example, unlimited embryo transfers. What that means that they will pay the surrogates travel, hopefully, compensation like cycling allowance, etc., for that, but they might not cover, or they will not cover the clinic's transfer. Depends on what you have with your clinic. So here it actually covers both. So those kind of synergy effects are also very important. We also offer baked-in discounts. For example, we cover the medications, genetic testing, unlimited transfer fees are lower than just working with our clinic. So that's like great benefits from a financial perspective. And when we say unlimited, like I said before, unlimited embryo transfer, that goes for both sides, agency and clinic. Another great thing is that when we do this integrated journey and the Peace of Mind program, we can offer quite hefty discounts on the journey. So not only those medications or unlimited transfers, etc., that I talked about, but also we give additional $20,000 discount when working with PFCLA as your clinic, which creates a quite beneficial financial program, especially within the fixed fee structure. I think we have a webinar about that later this year, or we have it from last year, about the variable journey when you pay as you go versus a fixed fee structure. We only work with fixed fee structures, and we give that discount on the fixed fee structure when you work with our clinic as well in the Peace of Mind programs. And then one thing that's really important and that I learned the hard way from my first journey is that no fees are to be decided here. So like the transparency is really key, and we include that all in one pricing because we can control both sides and we can fix that cost. We can give a really great overview and transparency of what is this actually going to cost and how will that be spanned out throughout your journey, basically. So all of these to be decided. We'll see what happens. Those kind of arguments, it's not a great idea. You can be hit with a lot of hidden, unexpected costs, we take that off the table here, which is a nice thing. So that's a little bit of the financial side of things. So let's look at our peace of mind program then a little bit. So what does that actually mean? I see some of the text is cut off there at the bottom. I hope that you can still read that. I'll spell it out as well. So basically, what we wanted to create is something that when you know what you're going to be paying for from day one. So all these hidden, unknown variable costs, they are taken off the table. Our fixed fee covers all of it. So what are some of those unexpected high variable costs? Let's say, for example, you need a new embryo transfer, so multiple transfers. Rematching with the surrogate can be costly if you need to pay for the rematch, or if you had a miscarriage and need to pay new compensation again, or for the new match, or legal fee, etc. All of that is kind of taken off the table with us. So you can just kind of focus on choosing the best donor and surrogate, not think about how close does she live to the clinic because I have to pay for travel costs and those are variable, or any of those other things. So just skip that step, choose the best donor and surrogate, and we'll cover everything else. And then the most prominent thing, of course, also being that one team experience. So having that one team, one process, decades of experience on each side, and taking care of that all together in one place, guiding you through that process. So that's kind of the whole idea inception of the Peace of Mind program, based on the feedback on how surrogacy journeys in the past don't really work that smoothly or greatly. Then let's talk a little bit about customizing, right? So when you do a research of this journey, there's going to be different approaches. Different agencies and clinics are going to be more or less flexible, might lock you in on different selections. So what is important to think about is that in the Peace of Mind program, for example, if you like a donor from an outside agency, you can actually still enjoy the integrated journey of the Peace of Mind program. We can actually have you choose a donor from another agency, and we can still be your IVF clinic, surrogacy agency, and proceed with that same integrated approach. It's about the genetics of your child, right? It's not about us choosing or locking you in with our donors. The same with the specific attorney. We have a great list of amazing attorneys, vetted, experienced. But if you really prefer a specific attorney, we can still make that happen within that journey. So this is your journey. There has to be some frames, around this journey that we fix, but this is really your journey. And as far as we can be flexible, we're happy to be flexible. That's important to remember as well, and not get too locked in with different choices. All right, a couple of minutes before schedule, which is great. If you have any questions, please feel free to put them in there. But if you do feel like you want a bit more of a one-on-one approach and discussion on this, then we're happy to book a complimentary consultation, just a time to walk through, your specific needs and questions about the programs and this journey overall. Like I mentioned before, we're all experienced with surrogacy as intended parents, surrogates, or egg donors. So we're happy to share our own experience in addition to walking you through our programs in depth. You can send an email to me, or you can go to our website and fill out a form, and you'll be kind of allocated to the right person. And look out on our website for new events, etc. We do in-person events as well as online webinars monthly. So there's a great database of different resources and topics that you can discuss and explore. Next month we'll have a legal take on surrogacy in the US, talk about the legalities and legal aspects, which are obviously very important. But yeah, let me see if anybody has any questions. If not, then thanks so much for joining in, and I hope that it's been useful. Now I'm just going to stick around for another minute or two since we wrapped up a bit sooner, and see if anybody has any question on this or anything else related to surrogacy or egg donation or IVF. I know we're, like I said, in all different stages of our research probably, so I hope you found something useful, and that wherever this journey takes you, that you have a great experience and that you make your dreams come true of having a family. It's a tough process, and it requires a lot of research and a lot of thought and a lot of cautiousness, because it is as far as the agencies goes, quite unregulated. So be cautious out there. Make sure you find a great agency and clinic to work with. I don't see any questions as of now, so just gonna see if there's anything else here. But it seems like there isn't anything, and now even the lights are going out, which is maybe the universe sign. So I'll just move around there, see if I can get the lighting back. Perfect. So if there's no questions, thank you so much. Really feel free to reach out. We would love to support you. We have great resources, attorneys and doctors, etc., to connect to, both US and local around the world. So really feel free to use those resources. And thank you so much for joining us today, and I hope you have a great day, evening, wherever you are. Take care out there. Thank you so much.